when we talk about dClinic and the global solutions, healthcare solutions, as dClinic is rendering, I would like to see, I believe there's going to be a problem with compliance concerns in different parts of the world. For example, if you step into the United States, you'll have to comply with HIPAA compliance, you know, and then privacy concerns. I believe Australia should have a similar control with the patient data, and Europe as well. I'm not sure about Indonesia yet. How does the privacy laws in place for patient data, but that should be concerned. How do you intend to handle that, or how are you already equipped to handle that?
Yeah, so that's a great question. So the fact of the matter is, I keep talking about this hybrid blockchain system. Underpinning our blockchain is a proper standards-based clinical modeling system. That's very important. So what I'm telling you is when the data is saved, when the data is coming in from all of these sources and then being saved, it is meeting SNOMED standards. It is HIPAA compliant. It is standards-based data. In other words, that data means that regardless of what other system touches it. And that's very, very important. We need to have that quality of data. We need that assurance around the data. So from a compliance perspective, we tick all the boxes. It is absolutely necessary. Our integrations, all the integrations and interoperability that we offer is FHIR-based. Now, the reason we've done that, again, is to meet the standards that we think are not just the standards of today, but the standards of tomorrow. So we know that data is absolutely critical, and we know we can value add to that data, and we know we can tick that data off. One really important point also is that often we get involved with compliance, and when we have the data then displayed back to the patient, especially the patient, then a lot of the data is so complex, the patient themselves can't understand it. So data needs to be readable. It needs to make sense to the patient. Otherwise, the patient is clearly going to be in the dark. So what we do also in our clinical modeling is we actually have that data revert into patient language that the patient can understand. So, and I think that's extremely valuable, Robbie. I think the fact that patients can see data in a meaningful way is something that I think is critical for proper...
Very true. That means if they see it, they feel taken seriously. And what Richard is saying is more than a system. It's something we really need. Of course, there's a lot of education to doctors, to other caregivers, but I was saying earlier that it's much more effective to invest in prevention.
Of course.
And with the system in Indonesia, I'm advocating you should make the primary care the gate watcher. Okay? Re-evaluate the position of a GP. Make them important again. Let them decide on referral, because that's going to save you money. And they don't see it that way yet. Why? Because the budget isn't sufficient in order for the GPs to be paid adequate salary. But I was thinking, in fact, if you concentrate on the primary care and the occupational health, in fact, you cover already the whole population, the economic important population. Of course, workers, they get sick.
Of course.
Okay, but workers need to be educated also. Hey, you want to keep your competitive position at the company?
Be healthy.
Be healthy. That's how you support your family. I mean, give the responsibility back to the people.
Put the onus on them.
And what we see in countries who are far more developed, this right of having social security is really considered as right. In fact, the economic problems of Europe or any other country can easily be solved unless But they have to change the social security system, and that's not possible, because that's going to cost you votes. Because it's already a right that people, this is acquired, but they cannot pay. I've lived so long in Belgium, okay, 46 years. I've studied there. It has only 10 million people. If you look how many people are working, maybe half. How is this possible? How can this 5 million pay for the other 5 million inactive? So that's why I'm telling to Indonesians, hey guys, you have 170 million. And this is the message that I have, and this is worthwhile for me. Rather than opening a luxury clinic and making good money, but I will be bored seeing always the same pathology.
That's such a great thing. We'll have to wrap this up. We'll meet again.
Thank you, Santos.